welcome to the Stronger After Stroke podcast. I'm your host, Rosa Hart, the stroke nurse navigator at Norton Healthcare. And for Heart Month, which is the month of February, we have a guest straight from the heart, Dr. Sofya Kuznetsov. She's one of our cardiologists. She's specifically an electrophysiologist, right?
That's right.
It's a big word. Can you tell us what that means?
Yes, so I'm a cardiac electrophysiologist, which is a cardiologist who specializes in cardiac arrhythmias, or abnormal heart rhythms for short. It's a subspecialty of cardiology, and we treat people with a lot of arrhythmias. We medically manage them. We do procedures. I also deal with cardiac devices such as pacemakers and defibrillators. And we see a lot of patients with atrial fibrillation.
So you meet a lot of people after they've had a stroke and are being worked up for atrial fibrillation, correct?
Yes.
So if someone comes to you and they've never met you before, but they had a stroke, if they come to your office, do you ever get asked, now what does my heart have to do with my brain?
That is a very common question because people who had strokes, a lot of them never had cardiac issues, so they're very confused why they're seeing cardiologists all of a sudden. Atrial fibrillation is one of the more common arrhythmias that we treat, and it's one of the very common causes for stroke.
Can you explain how atrial fibrillation in their heart that causes a stroke?
Absolutely. So your heart squeezes the blood to the rest of the body, and it has 4 heart chambers. The blood flows from atrias, which are upper heart chambers, to the ventricles. And normally heart beats in sync, where you have upper chambers squeezing the blood out into the lower heart chambers, and then the blood goes to the rest of the body. So that's your normal heartbeat. Once the heart goes out of rhythm and you go into atrial fibrillation, instead of squeezing the blood efficiently, your upper chambers or your atrias, they start quiver instead of squeezing regularly, and that causes the blood to stay there for longer periods of time. You can form blood clots that go to the brain and can cause a stroke.
How can a blood clot go from the heart all the way to the brain?
The left side of the heart is directly squeezes the blood out to the rest of the body. The blood clots can go to the arms, legs, and brain is one of them. It's one of the closest things to the heart, so that's can commonly make it over there. And with this irregular heart rhythm, that's a very common. Patients with atrial fibrillation are 3 to 5 times more likely to have strokes.
So does it have anything to do with a PFO?
So PFO is a structural issue, and it's different causes of strokes. So some people can have a hole between their upper heart chambers. PFO stands for patent foramina valley. It's a little hole between the upper chambers of your heart that everybody have in utero when we are growing. And then it closes in most people, but in some people it stays open and it doesn't cause problems. But in certain people, if you have blood clots in the veins, they can travel to the left side of the heart and cause stroke that way. So that's a little bit different than it's another cause of atrial fibrillation, cause of stroke, not related to atrial fibrillation.
Okay. So just because someone has a PFO doesn't mean they're necessarily at any risk for atrial fibrillation.
Absolutely. Those are not related.
Okay. But you might get sent to a cardiologist for either one after a stroke.
Yes. So you will see electrophysiologists most likely if we find no other causes for your stroke. Strokes there are different types of strokes. There are strokes where you can have blood clots that cause the decrease of the blood flow to the brain. And it can be caused by bleeding in the brain. So those are different types of strokes. So arrhythmia or atrial fibrillation causes the type of stroke that comes from blood clots that we say originate from the heart, and that can be. There are several reasons for this. And if you find no structural abnormalities in your heart to explain the blood clots, then the rhythm is the only things left to look for.
Is that why a doctor might order a heart monitor for someone to wear at home after they go home after a stroke or TIA?
Yes. So atrial fibrillation in a lot of people doesn't cause symptoms. Some people are highly symptomatic when they go out of rhythm and they know right away, but some people can stay in atrial fibrillation for days, weeks, and even months without knowing they have a problem until they have a stroke.
What would be some of the symptoms they could experience if they're in atrial fibrillation?
So symptoms such as one of the more common ones is heart palpitations, heart racing, but also shortness of breath and fatigue. Sometimes people don't feel their heart racing, but they feel more tired. They just feel like they can't do the same things that they used to. They're more short of breath with activity. So those are the things to look out for.
So it is possible to have their heart beating irregularly even if they're not feeling any of those symptoms?
Yes, and some people have no symptoms at all. So that's why watching for atrial fibrillation, especially in people with stroke, is important long term.
And you implant things called loop recorders as well, more long-term heart monitors, correct?
Yes, so the longest monitor we can put on a person is for 30 days, the one that we have from the outside. It's usually a little patch that you wear. And the goal for any monitor is to detect atrial fibrillation that people don't even feel, but that does increase your stroke risk. So after 30 days, 30 days may not be enough for people to have an episode and for us to find it. Sometimes it's something that happens rarely, and we may not detect atrial fibrillation within 30 days. So there is an option for implantable monitor called loop recorder, which goes in the upper side of the chest, right under the skin, and it can sit there for 3 to 4 years. Now the battery on our newer monitors, those loop recorders, last 4 years, and it's a device that doesn't do anything to you, but it monitors your rhythm consistently. And if it detects atrial fibrillation, we can adjust your medicines and manage that appropriately to prevent another stroke.
So I've heard mixed messages in my time as a nurse. I've heard some doctors say it can take days, weeks, months of being in AFib to form a clot that can travel to the brain as a stroke. But I believe I heard recently that the evidence shows it's actually a lot shorter of a time period, right?
I don't think we actually know exact time of how long it takes to form clots. And interestingly, some people who have atrial fibrillation and atrial fibrillation episodes, the timing when they have the stroke were unrelated to the episodes. So it's the fact that you have atrial fibrillation, and there's some other risk factors that make you more likely to have a stroke with atrial fibrillation that would necessitate blood thinners. And people have different risks for stroke. So not everybody with atrial fibrillation is the same. If somebody's younger and they never had a stroke, and they have no other risk factors for stroke with atrial fibrillation, they don't necessarily need to be on blood thinners. But people who already have a stroke and we find that they have atrial fibrillation, that puts them at much higher risk for having another one.
What are some of the other risk factors for stroke that are correlated but not exactly related?
So we say the age is an important one. It's being over age of 65. Once you reach 75, that increases your stroke even more. High blood pressure, diabetes, having coronary disease or heart blockages, heart failure, and as I said, history of stroke. We do use a special scoring system that gives us the stroke risk that helps us determine who is at higher risk of stroke. And actually having prior stroke, gives you 2 points on that scoring scale. So that's
so you can kind of stratify somebody's likelihood of encountering a stroke based on how many of these factors are at play in this one person.
Absolutely. So the difference that the loop recorder makes, if we detect atrial fibrillation in somebody who had stroke, we will manage things differently. We will switch and put you on a blood thinner, because not everybody who had stroke without known atrial fibrillation needs to be on the blood thinner. Blood thinners have side effects of bleeding, so we don't want to put everybody on one until we know that you have a rhythm problem.
Right. So as the stroke navigator, I'll call a lot of people after they've had a stroke and they'll be wearing their heart monitor, or they may not want to wear it because they're like, why do I need to have more things strapped to me? I'm at home. I want to be free of all these wires and everything. And so I try to explain to them about the potential like treatment that might be involved, and that they're like, well, why didn't we start on a blood thinner in the hospital then if they think this might be possible? And so we have to have that conversation about the risk versus benefit of these blood thinners, because we don't want to just pass out Eliquis and warfarin and all these blood thinners to people who are at risk for bleeding.
Yeah, and we don't want to put people on blood thinners for stroke because we don't know what their cause of stroke is. If it was not a blood clot and not atrial fibrillation, the blood thinner is not going to decrease your stroke risk. It's just going to put you at risk for bleeding. So it's always risk or benefit of any medicine we use. And blood thinners are important ones. They do a lot of good things. They prevent strokes and they prevent blood clots, but they also can cause bleeding.
Yeah, definitely. So I really appreciate the thorough workup process that we go through with our patients. And I appreciate all the care and thought that goes into it from every specialty, weighing all of these different possibilities, because it's not just a one size fits all. So some people might hear that their friend who had a stroke is on a different medicine, and that's probably because it's the one that's safest for them, because all these different factors have to be taken into consideration.
Absolutely.
So is there anything people can do to prevent AFib?
So there are certain things that make you more likely to go into atrial fibrillation. Definitely, as we age, the risk of atrial fibrillation becomes higher. Actually, 25% of people over age of 65 are diagnosed with atrial fibrillation. It's a very common arrhythmia. So that's something we cannot change. But things like weight, extra weight, so that is a risk factor for atrial fibrillation. High blood pressure, sleep apnea is an important one. So people, and sleep apnea goes together with extra weight as well. So people who have sleep apnea are at high risk for having atrial fibrillation. So we have to address that too, to manage this appropriately.
Okay, so we started this out because we have questions about what is the heart and brain connection. But in case you didn't get to listen to our episode about sleep apnea and how that's related to stroke, I would love to hear your explanation of what does sleep apnea have to do with my heartbeat?
Right. So sleep apnea is highly associated with different types of rhythm issues, definitely AFibs being a common one, but sometimes people have extra heartbeats that may be caused by sleep apnea. So what happens when you have sleep apnea, and people always say, oh, I sleep fine, I don't have any problem sleeping, but that's something that you don't feel. But what happens when you have sleep apnea is you stop breathing for a few seconds at a time, it drops oxygen in your blood, and it puts strain on the heart. So it can enlarge the upper heart chambers that make you more likely to go out of rhythm. So it's just that fact of having low oxygen putting stress on the heart makes you more likely go into atrial fibrillation and can cause those arrhythmias that cause strokes. And so this is all connected.
It really is. Each individual person has to be thought of holistically. And so that's why people might need a specialist for different body systems, because that's part of holistic care, which a lot of people think the less doctors you have is more holistic. But in this case, I'm really thankful for the interdisciplinary approach of getting the best care for each system.
Absolutely. And I'm happy to work with so many great doctors, and I feel like we work as a great team, and that's all it's all done for us to take the best care of the patients.
Yeah, definitely. And are you accepting new patients, or do you mostly see people if they've come to you in the hospital for a loop recorder?
We do see a lot of patients in the office, and yeah, I still take new patients. I think most of my colleagues, we have 6 electrophysiologists now, we do take patients. We do sometimes we do those loop recorders in the hospital right after the stroke if we don't find the reason for the stroke, but sometimes people choose to do the outside, the 30-day event monitor first, and that is a good way to go about that as well, and you can get a loop recorder later, but that can potentially interrupt the monitoring time. So we do a lot of those loop recorders in the hospital, but we also be happy to see anybody in the office and discuss this more.
Exactly. So you're with Norton Heart Specialists, but if you live outside of the Louisville area or our region, because we see patients from all over the region, you could probably find a cardiologist near you by either calling your insurance and finding out who that would cover as a preferred provider, or getting a referral from a primary care provider. If you would like to connect with the Norton Heart Specialists, I will be posting a link in the show notes to schedule an appointment with our cardiology team. And then we'll also have some more information if you'd like to read more about AFib and how it's connected to stroke, as well as what you can do to prevent AFib. So thank you so much for tuning in to the Stronger After Stroke podcast. In order to have your best life, it's important to make sure we don't have more strokes. So subscribe to this podcast to be notified the next time an episode is released, and I'll see you in the next one.